I'm going to show you how to test the new OASIS items in Barnestorm Office. This video does not cover specific rules or guidelines. Please refer to the CMS OASIS Guidance Manual for details. You'll be able to safely test OASIS assessments before January the 1st. We will add 3 test patients with the last name OASIS into your Barnestorm system. These patients will allow you to use the appropriate dates in 2023, which will trigger the correct OASIS questions. The test patients will have the following data preloaded for ease of testing: ICD codes, medications, a 45 episode starting on January 1, 2023, and a facility stay from December 28th through December 31st of 2022. You'll be able to add each OASIS assessment in order, starting with the start of care, transfer, resumption, recert, and then a discharge. Be sure to use the assessment dates that flow with the order of the type of assessment that you're keying in. Okay, so we're going to start off with adding a start of care OASIS. Make sure you have the OASIS patient selected, and then from the OASIS tab in Barnestorm Office, click on New. And you'll notice the assessment date will have January 1st of 2023 already inserted in there for you. Go ahead and click on Start of Care and then click on Create OASIS. This first screen is the same. You might need to insert an employee up here at the top. Review this information and then click on Next. Right away, you'll notice some of the new questions will appear. I'm going to go ahead and just start to answer some of these questions. Some answers get pulled from the referral automatically. Language. This is going to default to Other. You are able to type in another language here, or you can select the English or Spanish bullet to have it inserted into the field. And then that will allow you to answer the part B of the question if the patient needs help with communication. I'm going to click on Next. Here's another new question. This one is a check all that applies. Next. A few more new questions. For the brief mental status interview, if an interview is started, you'll click on Yes. At this point, the rest of the questions will appear. It's important to review the manual for the guidance on answering these questions. Click on Next. Another new question. Here's another new question. Once again, it's important to read the manual to find out how these questions are answered. And here's another question. Select all that apply. On the high-risk drug classes, we do have this button down here you can click on. This will check the patient's med history to see if any of the medications are included in the class listed here, and then it will automatically check the boxes for you in section 1. On this new question, if you do select some of the options in the first column, it may require you to add additional information. So if you select a box and you notice pink fields appear to the right, then that means you need to at least check one more option. And you'll finish the OASIS like you normally do. You'll do the finish and verify to search for any missing or invalid information, and then you'll mark the OASIS as completed. This picture shows you the significant change in the recertification. You can see that many OASIS questions have been removed. You'll also be able to use the iKeys system to send test files to validate. The record will get rejected and show all of the date errors, but this does allow you to run through the validation tools for the OASIS E items. You'll run the validation like you normally do. On the iKeys system, you'll accept and proceed, and then from the data specifications, you'll use the 2003 version, and then you'll click on Upload Test Assessments and locate your OASIS and wait for it to process, and then it'll give you your information on the OASIS questions with errors.